Let's go through how to coach the pigeon stretch with a focus on deep breathing, core engagement, and pelvic floor relaxation. This is an amazing stretch for opening up the hips, improving mobility, and relieving tension in the lower body, especially useful for postpartum recovery, athletes, or anyone with tight hips in general. First, we're going to get our client into the right position. They're going to start with a tabletop position on all fours. They're going to bring their right knee forward, placing it behind the right wrist. They're going to extend the left leg straight back, keeping the hips squared to the front. They'll keep their front foot flexed to protect the knee and find a comfortable angle for the shin, either more parallel to the front of the mat for a deeper stretch or closer to the body for a more gentle version. They're going to keep the spine long and the chest lifted with the hands resting on the floor for support. If your client feels any discomfort in the knee, they might try placing a cushion under the hip or shifting in a figure 4 stretch on the back instead. Before we deepen the stretch, let's focus on using the breath to encourage pelvic floor relaxation and hip release. We want to avoid the pelvic floor contraction here. All birth preparation exercises need to emphasize the relaxation component of the movement pattern. We're going to encourage the client to inhale deeply through their nose, expanding the rib cage and belly outward like filling up a balloon. As they inhale, they're going to allow their pelvic floor to naturally relax and soften. Imagine their sit bones are gently widening. They're going to exhale slowly, letting the body sink deeper into the stretch while keeping the core lightly engaged for support, but the pelvic floor relaxed. They're going to repeat this deep diaphragmatic breathing for a few cycles or however many you prescribe for them, focusing on releasing tension in the hips and pelvic floor with each exhale. Once they're finished on this side, they're going to switch over and perform the same steps on the other side.